Hi, everyone. My name is Dani. I'm a sports medicine physician in San Jose, California. Welcome to this episode of Case Bites. We're going to start our case. So my case is that of a 13-year-old male. He's a left-handed baseball player. He presented to me with left shoulder pain. His left shoulder pain started about 3 months ago. Now, initially, it was only after practices. He would develop some tenderness. He would develop some aching. He would rest, and it would all go away. The next day, he would go back, he would practice a little bit more, he would have pain, he would rest, it would go away. He would have a tournament on a Saturday, the pain would come back during the tournament, it would be achy for a couple of days after the tournament, and then it would resolve. And this went on for a couple of months, and he continued to play. It did get worse and worse over the course of 2 months. And then ultimately, right before he came to me, he had a tournament where he was pitching really fast. He felt a sharp pain during one of his pitches. He realized afterwards that he was unable to fully lift his arm. He could no longer play. He couldn't finish the tournament. And after the tournament, he realized that for the first time, the pain actually just stayed. Now he was having pain with everyday activities. He was unable to lift his computer. He was unable to lift anything with his left arm. And so he came to see me shortly afterwards. Okay. And needless to say, he was unable to pitch or throw at this point. So his physical exam when he came to me was he did have tenderness over the outside of the shoulder. So he had tenderness over the lateral aspect of the shoulder, kind of right here. He was unable to abduct his arm above 60 degrees. Now, for comparison, on his other side, he was able to abduct his arm to 180 degrees, so completely normal, okay? His internal rotation, his external rotation were limited, and his strength was 4 out of 5. In order to help us with the diagnosis, we did get an x-ray. Now, even before we got an x-ray, our differential diagnosis for somebody who is having shoulder pain, who is a baseball player, is quite broad. We worry about his rotator cuff. He can have a rotator cuff tear. We worry about a labral tear. We worry about a shoulder subluxation. Sometimes he can have a shoulder dislocation, which he did not have the history of shoulder dislocation, but certainly a subluxation can happen. We worry about a muscle strain. So all of those things are really kind of high in our on our differential diagnosis. And the one thing that we also have to think about when we're talking about young baseball players is something called little league shoulders, which I'll get into later. Okay. So for this patient, we did get a left shoulder x-ray, and his x-ray is shown right here. So you could see that on this x-ray, it looks fairly normal. Okay. There's his shoulder blade right here. His clavicle is right here. There is his arm bone, his humerus right here. Nothing looks subluxed. Nothing looks dislocated. You can see his growth plate right here. Okay, so his growth plate is open. Now, to me, his growth plate did look a little bit wider than the normal. And so in kids, it's really hard to tell because sometimes you look at a growth plate and you think, oh man, well, that looks wider, but it's actually normal. Okay. And so in his case, what we ended up doing was we ended up getting an x-ray of the other arm, so of his right shoulder, just to compare. Okay, so now if you compare the two, you can see this is also a normal looking x-ray. You can see his shoulder blade right here. There's his arm bone, his humerus, his clavicle, so everything looks intact. When you look at his growth plate on the right side, it does look much more narrow than on the left side. Okay, and I'm circling my mouse around it just to really show you. Now, I'm going to go back and forth so we can take a look at the two side by side. So this is his left shoulder. That's the affected shoulder. Then I go back to the right side, and this is his right side. And you could see quite a stark difference, right? This is much more wide. This is much more narrow, okay? And so in a player like this, when we see an x-ray where one of the growth plates looks wider than the corresponding growth plate on the other side, you know that this is a problem of the growth plate, okay? And so in his case, this is actually a fracture of the growth plate called little league shoulder, okay? Now, to get a little bit into the diagnosis, little league shoulder. Okay. So little league shoulder is an overuse injury. We see it in young baseball players, usually between the ages of 11 and 16. The peak is kind of at 13, 14. What happens is they have this repeated stress on the growth plate, okay? And the repeated stress really comes from pitching and throwing, but mostly pitching. If you can imagine a baseball player, the baseball player, when they're pitching, will go through a few motions. There's the cocking motion where they bring their arm back. Then there's the throwing motion, the acceleration motion where they throw and they release the ball. And then there's the deceleration motion, which is what they do at the end, where they have to stop their arm from moving. Now, the cocking motion, where they bring their arm back, exerts a lot of torque and distraction, but mostly it's the torque that causes this on this growth plate, okay? And so if the young baseball player does this over and over and over again, initially the growth plate just gets irritated. It does affect the cartilage, and the cartilage can get damaged, but initially with some rest, it does resolve. Now, if you keep playing through this, eventually what ends up happening is actually a fracture, so a crack through that growth plate, and that's why it appears wider on x-ray, okay? And so this is exactly what happened in the case of this player. He basically had pain, then he would rest and it would go away, and then he kind of kept playing through it. And after enough irritation to that growth plate, he did have a fracture through the growth plate. And so the management of these is basically rest. And a lot of the baseball players do quite well and they can return to baseball, but we have to be very serious about making sure that they take the time, they don't pitch, they don't throw in order to let this heal, okay? And so the rest time typically is anywhere between 3 to 6 months. Now, with this specific player, we took 3 months off of pitching and throwing completely, okay? At 6 weeks, I had him go back to batting. So he was batting, he was fine, he was pain-free, but no pitching just yet. At 6 weeks also, I had him go to physical therapy. Now, with these young baseball players, it's really important that whatever mechanics predispose them towards this fracture is fixed in physical therapy. So that's really between the coaches and the physical therapists, okay? So it's a lot of rotator cuff strengthening, fixing their biomechanics and really working on their form, okay? So at 6 weeks, that's exactly what I had him do. I had him go to physical therapy. They did a lot of rotator cuff strengthening, a lot of scapular stabilizations. Those are the two kind of things that you really want to do: stabilize the scapula and strengthen the rotator cuff. And then his coaches had addressed his mechanics. And so at 3 months is when he came back to clinic, and we got a follow-up x-ray. And so this is his follow-up x-ray at the 3-month mark, okay? And so if you take a look at this growth plate right here, you can see that it is much more narrow than it was on the initial x-ray. Let me just go back and I'll show you. This is the initial x-ray. This is the follow-up x-ray right here. Okay, so you can see that that growth plate is remarkably more narrow. Now, sometimes, even on the follow-up x-ray, the growth plate still looks widened, okay? And then in that case, I just use symptoms. So I go off of their pain level, their ability to move their arm, their range of motion, have they regained it? Are they able to throw without pain? But sometimes I always try to get this x-ray and just to see if there's been a change. And if there is, it really confirms that they can now go back to play baseball, okay? And sometimes this takes longer. So 3 to 6 months is what I've seen in my clinic. But with this particular player, 3 months was enough, okay? So now this was his outcome. He did physical therapy. He worked with his coaches. He was completely pain-free when he was pitching. And his x-ray confirmed that his fracture had healed. And so at the 3-month mark, I had cleared him to return to baseball. And he gradually got back in and has now been playing for a couple of months, and he's doing remarkably well. Now, another thing that you want to think about with these young players is they pitch a lot. And there's a certain pitch count that you really want to make sure that they stick to. Now, the younger ones, when their growth plates are still wide open, you really want them to stick to a certain number of pitches. And as they grow older, that number of pitches actually increases. But you really want to have a very serious conversation with them to make sure that they stick to that pitch number, because they can have this injury again, and it's really important to prevent that. Okay. So this player turned out quite well. He did very, very well. Now he's playing with a travel baseball team and is doing great. That's the end of this case bite. Okay. Thank you everyone for listening, and watch out for the next case bite. Thank you.